Welcome back to the Connect Network TV. Today we have a phenomenal guest joining us. Please help me welcome Dr. Stuart Seigel, a board certified endocrinologist who's making waves in the world of telehealth. Welcome to the show, Dr. Stuart.
How's it going? Thanks so much for having me on.
It's going great. We are so honored to have you here with us today on the Connect Network TV. Telemed to you healthcare is so amazing. Please share with our viewers more about the platform.
Absolutely. So Telehealth, believe it or not, it's actually been around for a while. Really, it's a company that's all about providing access to care for people who don't have access to care. And so, right now, originally the company was founded because in the rural areas, specialty care, basically care aside from primary care medicine, really wasn't available in those areas. And so it was started to be able to supply care to places where it was needed most. And originally, it was more done in kind of a business to business way, where the doctors would actually zoom in to clinics and work that way. But really, since the pandemic, it's allowed us to actually just do direct to member care, in the comfort of their home.
No, that's definitely a game changer, and I'm sure it's really, needed in many places. So let's talk endocrinology. How can this be treated effectively through the Telemed to You platform?
Yeah, so endocrinology, if we focus specifically on that, we're a specialty. So what is an endocrinologist? So an endocrinologist is a doctor. It's an internal medicine doctor who's specialized in hormones, right? Um, and so um, and so because that, hormones are, we basically check them through the blood. And so, you know, pretty much all disease processes that we treat can be evaluated through lab testing. And so, when a patient sees us, via telemed, we can do all the diagnostic testing that's needed, through their local labs. And so if you imagine, going to a clinic with a doctor, you go, you have a waiting room, you get checked in by a medical assistant, and then eventually, you're roomed and you see the doctor. The same process exists in a telemed environment. And so people, they sign up for the visit. We have reminders. They get checked in by somebody who rooms them, and then after that they can see us, right, basically just like we're doing right now. And it's interesting because I remember, prior to telemedu, where I worked, if you remember the pandemic, telemed was huge because it had to be done that way. And during that time, I had seen the most patients I've ever seen, because it was so much more accessible that patients who really weren't coming in for their appointments started to. And so, and really, I think that's kind of what led me specifically down this path, to telemedu, was because it's such an accessible way of giving care.
Absolutely. This is so convenient, definitely convenient. I know it has been, firsthand for me. It's definitely a very convenient way to see your doctor. And this is almost a one-stop shop. And I know many people are curious about the specific conditions that you treat through telehealth. So can you share some of those with us, and how else can we utilize your platform?
Absolutely. And so the conditions that we treat, we're endocrinology. So we treat diseases of the thyroid, diabetes for sure, osteoporosis. We treat diseases of the pituitary, which is the master endocrine gland of the body, the adrenal gland, low testosterone. So, we really, pretty much all endocrine glands, that's what we do. So that's what we treat, and any condition associated with that. Absolutely.
That That's wonderful. And let's talk a little bit about diabetes. November is National Diabetes Awareness Month,
Mhm.
and the holidays are just around the corner. We will definitely be eating more and paying less attention to our health, unfortunately, because we get so into the holidays. So,
Sure.
what should people know about diabetes, and what diabetes treatment should our viewers consider?
Yeah, so I think that, I think, one thing that I do see frequently, especially when people are newly diagnosed with diabetes, is that, they receive this diagnosis of diabetes, and they basically lose hope, right? So they feel that, and maybe they have family members who have suffered the complications of diabetes, for example, the kidney disease, the eye disease, the nerve disease. And so they feel that they're going to go down that similar path. But today we really have excellent monitoring technology. We have really great medications that we offer to patients that make a tremendous improvement. I mean, through the years, seeing these kind of transformative medications and how it makes the management so much easier. And so the bottom line is you don't have to lose hope if you have this diagnosis. You can still live a great life without complications. Another thing to think about is, I think a lot of people think, oh, I have diabetes, I got to go keto, right? And so keto is this, big craze right now. And I think that you don't actually have to do that. What I find with patients is that really just having a balance to the nutrition plan. So not, we have the holidays, avoiding partaking in any holiday, treats. I would say you don't really have to do that. You certainly can partake in treats. And it's all just about a balance. And I think that a lot of people feel that, well, because I have diabetes, I'm the one that has to have the balance. But I think it's the same balance that really should apply to people, even without diabetes. And then I would say another, thing to think about is, I think a lot of people, when they see an endocrinologist for their diabetes, they're kind of worried that it's just going to be an awful experience. And I think, today, unfortunately, in the healthcare system, things have changed and it's less accessible. And doctors see more patients. So it's really, maybe the experience isn't kind of where they'd like it to be, less supportive, right? Because it has to be quicker and shorter visit times. And so, so they have this idea that they're going to go see the endocrinologist and it's going to be as if they're getting a report card for how they're doing with their diabetes. But at TeleMed we really don't do that. So we have, a team, all members of the team have been touched by chronic disease such as diabetes. And everybody's incredibly compassionate, really supportive. And the environment that we provide is really, we basically take the approach that, if a patient is coming to see us, it's because they need help. And so we have a judgment-free zone for sure. And so those are kind of the things that I think are important to, think about when getting care for your diabetes.
Your services and access to your doctors don't require a doctor's referral. So if one of our viewers would like to sign up and get started with you, how do they go about making an appointment?
So we actually have a special program. So at TeleMed we see patients, across the nation. We have a majority of business in California, but we also have a lot of business across the country. And we have a special program that's really designed for access, just like unfettered access. And what they would do is they would reach out to us via the website. You can go to telemedtoyou.com, which is Telemed, TELEMED, and then the number 2 in the letter U. And then they can find the diabetes care program on there, click it, and then just sign up online. And then we reach out and get things scheduled pretty quickly. It's really an incredibly accessible program because you have direct access to the clinicians that manage the diabetes. We have a continuous care model so that we monitor the blood sugars and we can provide assistance in between visits. Currently, it's kind of like you see the patient and then 3 months goes by, you see him again, but so many things can happen in between. And so we're actually there providing support even in between the visits.
Thank you so much. Again, we've been so honored to have you today. So much helpful information and so much wonderful information today. To our viewers, please don't go anywhere, Connect Family. We will be right back.
Tired of long wait times and complicated referrals just to see a specialist? At Telemed to You, we make it simple. See a provider from over 20 specialties. No PCP referral needed. From endocrinology and mental health to dermatology and cardiology and more, we've got you covered. All from the comfort of your home. And you can book an appointment in just a few clicks on your phone or laptop. Telemed to You. Virtual quality care for everyone. Visit telemedtoyou.com to book now.